Unfortunately, the question about clinical nurse specialists are, in my opinion, do they act more in a medical domain? Should they be more in a nursing domain? And I'm going to fold into this answer a nurse practitioner because they really are very different. Clinical nurse specialists, unfortunately, are very rare in the United States anymore. And when I traveled all over the United States Monday through Friday for 10 years, when I would sit on a plane and talk about where I just was, talk to myself about where I was just lecturing, I would ask myself the question, would I like to work there? And the places that I said yes to had a strong clinical nurse specialist component. They were the mentors. They were who we could hold up and say, this is expert nursing. And unfortunately, we needed strong nursing administration to support their salaries because you couldn't really justify with patient populations. They didn't just, I don't say you couldn't. They choose not to look at the real influence that they had. So unfortunately, there's not as many. Where they are usually is the sign that represents a Department of Nursing that is strong, in charge, and believe in that expertise. They are truly a remarkable element. Now, their practice should be predominantly based on nursing diagnosis. They are not, if they're clinical specialists in wound management, then clearly they're also looking at some of the medical treatments for it. By law, they cannot order it, but they can initiate a protocol. And some of this is just games we play, but they certainly have the expertise to write the protocol and to initiate it. I am enamored with high respect for clinical nurse specialists. I wish there were more. Clinical nurse specialists are not nurse practitioners. Nurse practitioners are diagnose and treat nursing diagnoses and medical diagnoses. Now, I don't want to pretend to a lot of nurse practitioners are competent or expert in nursing diagnosis, and that's unfortunate. To be a nurse practitioner, you should be a seasoned, experienced nurse. And when I went back for my NP 20 years ago, I had been a nurse for 20 years, I received no education on nursing diagnosis in the program, and really nothing that I would say represented nursing. For me, it was okay because I went to learn medicine, a certain part of medicine. As I'll say today, there really is an illusion that medicine is very complex. And I'm not at all saying it's simple, but I'll tell you, because I'm in both worlds, it is much more difficult to diagnose and treat nursing diagnoses. I can make a diagnosis of a diabetes in less than 5 minutes. And now I spend hours and hours helping someone risk for compromised engagement and trying to engage them into understanding that this thing that they don't feel is destroying their body as we speak. In my population, family members may all have diabetes, and so they say to me, it's hereditary. I said, no, being overweight is hereditary. Lack of exercise is hereditary. Your eating patterns are hereditary. So I find it interesting that nurses are delusional about nursing and think medicine is just this. And so when we think something is the epitome of whatever, of science, of practice, then we look at it with our eyes glazed. And we're going to talk about that this afternoon with faculty. They need to deglaze these students' eyes. They need to understand that there are physicians on the unit. Let the medicine practice medicine. But who's practicing nursing if we're practicing medicine? The medicine is so concrete, powerlessness isn't. Chronic sorrow isn't. Huge. And when you, as a person, experience it yourself and experience the expertise of a nurse, you don't remember that they picked up your dropping blood pressure or your wound infection. You don't remember that. You remember the moment where they were present for you, when you were weeping without judgment. Yeah.
Thank you.